Hi, I've just got a couple of patients arriving today. Will you just give us a shout when they arrive, please? Thank you. So we're a small team, but yeah, we all work really well together, and we all are responsible for different trials. Hello, trials, Donna speaking. It was my nan that really advised me to, so I was thinking I wanted to go into sort of a sciencey sort of background, because that's what sort of I really like doing at school. I like doing, you know, chemistry and biology. I really like being patient fronting, but still the science side to it, and you know, and you get to help people. So yeah, it's just the ideal job. I can't imagine doing anything else. Are you pleased it's Friday now, Paul? Last injection.
It's caught up with me today.
Oh, has it? You're a bit tired. Paul's had a bone marrow transplant, and then unfortunately he got chronic graft versus host disease. So first line treatment for that is steroids, but Paul became refractory to them, so he decided to enter a trial. There's no gold standard for the second line treatment at this point, so he decided to enter a clinical trial. So this trial wouldn't be available because it's not standard of care. At the moment it's an investigational agent. The only way to move investigational agents forward to gold standard is to do clinical trials, so this is part of a clinical trial. So as soon as we get the results of this, we can analyse them and perhaps move it forward if we get a positive result. So that's it for another few weeks then, Paul. So you've got your appointment for next time, haven't you? Yeah. Okay. Lovely. Right. My role wouldn't exist without the donations to Cure Leukaemia, and some of my colleagues' roles wouldn't exist either. So these were roles that just would not be funded by the NHS. So yeah, and it all goes on donations, so yeah, any donations would just be, you know, just amazingly, you know, helpful to our patients. Hi Lizzie. Hello. You had your hair done? Yes. Looks nice. Hello. Here's Bobby in the familiar camera. So Lizzie's on a trial called Viola, and it's a trial for people that have relapsed, with patients with relapsed AML. It's an important part of when Liz is on treatment is just to keep an eye on her blood counts, because Liz's blood counts do fall, so she can get low platelets and she can get anemic, so we arrange blood products for her. So we'll do a blood test today just to make sure that all your blood levels are in normal range. Thanks, Lizzie. So the nurse in charge of the day unit will receive all the chemo from the porters that's been delivered from our chemotherapy aseptic lab, and then the nurse will check the drugs and they'll put them in the correct storage facilities there. So that's a really important job, because you know, if this is a refrigerated drug, if it was to accidentally put in the room temperature, then we wouldn't be able to use the drug. It'd have to all be remade. 2 vials of azacitidine for Elizabeth Dean, K306645. 16 months ago we were, you know, offering her, you know, we would have sent her home to die, but now this trial's available. You know, within 3 months of being on treatment in that trial, she went into a remission and she stayed in remission. So it's just amazing. And now Lizzie's working again, you know, she's trying to get back to normal. So it's just great to see the whole process of her being so poorly, us getting her in remission, and then now she's been able to get on with her life and get back to being normal again.
How many times do you wash your hands a day?
Lots and lots of times. I don't think I can count. So we're just going to get Lizzie's blood analysed today. So we're very fortunate that we can get an instant reading today. So that'll give us full profile of Lizzie's full blood count. That's lovely, thank you. So we'll just check the results over. Lizzie, all your bloods are fine, so your platelets are 30, so that's amazing, isn't it? And HB 104, neutrophils 2.37. So perfect, so you've had a full MOT, so that. Yeah. Thank you. I'm normally there when good news is broken, and I'm normally first one to see the good news, because we arrange the bone marrows and I'll be the one that checks the bone marrow when it got back. So it's really a lovely feeling when you see that bone marrow report and you see a remission, and you just know how much it's going to mean for your patient. So, and then sitting in the consultation and the consultant gets to break that good news, it's just, yeah, it's just, there's no better feeling than, you know, seeing the patient, you know, and the relatives receive that good news. It really is amazing.